Hello and welcome to NHIS in a Week, where we give you highlights and happenings in the authority and the NHIS. My name is Ifia Cherma. Now the headlines. Chief Executive of the National Health Insurance Authority visits Kibu Renal Unit. Zambia delegation pays courtesy call to the NHIA. Ex-President Kufuor impressed with NHIS CEO 2 months into role. In the wake of the implementation of the free National Health Insurance Dialysis Program, Dr. Dacosta Abuaje, Chief Executive of the National Health Insurance, has visited the dialysis unit of the Kibu Teaching Hospital to engage healthcare providers and patients on the new directive. Per this initiative, every patient aged 18 years and below and adults aged 60 years and above will receive free dialysis care, 8 sessions per month, at a cost to be borne by the NHIA.
Children 18 and below are having their dialysis sessions, all 8 free. And also, adults aged 60 and above are having their dialysis, all 8 sessions free. Then between 19 and 59, we are giving them subsidy. What I can assure the public is that the government do have a clear sustainability plan which will be unveiled.
The Chief Executive was accompanied by the Deputy CEO, Dr. Mrs. Yapuka Baden, Deputy CEO in charge of operations, Mrs. Louisa Atta Ajman, and other directors within the authority.
We really appreciate the efforts the government and National Health Insurance.
A delegation from the National Health Insurance Authority, led by the Chief Executive, Dr. Dacosta Abuaje, paid a courtesy visit to the former President of Ghana, John Agyekum Kufuor, at his residence in Peduase, and expressed their profound gratitude for the former President's pioneering role in the establishment of the National Health Insurance Scheme in 2003, a landmark initiative that has since transformed the healthcare accessibility in Ghana. Ex-President Kufuor praised the current management for their efforts in sustaining and expanding the scheme, emphasizing the importance of continuity and innovation in policy implementation. President Kufuor affirmed the positive impacts the Chief Executive, Dr. Abuaje, had made in a rather short time in his role and prayed for unity between management and the board.
Somebody being inducted, because that's how I say, 2 months into any office is like a period for engagement. You are impactful already. See that you are whenever you are also flanked by these powerful, I would say, ladies and gentlemen. They have issues now. I'm sure knowledge and please come to grips as quickly as possible.
An 11-member delegation from the Committee of Government Assurances of the Parliament of Zambia, led by Honorable Mandidi Kaliyi, visited the National Health Insurance Authority head office in Accra to understudy the running of the National Health Insurance Scheme and share best practices in strengthening health insurance in the African region.
Basically, we are here on a benchmarking tour. In essence, we are here to learn. We're here to learn. Particular interest is actually the National Health Scheme. We have ours back home, which is still in its infancy. Yours is quite advanced. So we thought it very, very, very important to come and learn from you, our sister nation, just like you did mention that we come a long way as sister nations.
The Deputy Chief Executive in charge of operations, Mrs. Louisa Atta Ajman, who received the delegation, expressed gratitude to the Zambian team for choosing Ghana's NHIS as a model scheme worthy of emulation on the African continent.
Zambia, Ghana has a very good relationship, and our leaders are really doing a lot for us. So for you, you are always welcome to Ghana, and then of course the National Health Insurance Authority. Our team here, they are all expert directors, and they are all here to help. They're going to do a presentation for you, and after that, I'm really hoping that your expectations will be met.
The Pharmaceutical Society of Ghana, led by its president, Dr. Samuel Kwaudonko, and other officials, paid a visit to the National Health Insurance Authority in Accra. The purpose of the visit was to congratulate Dr. Da Costa Abuaje on his new appointment as CEO and to present several suggestions aimed at strengthening the partnership between the NHIA and PSGH. At a meeting, PSGH emphasized the need to increase the number of community pharmacies linked to the NHIA, suggesting that this would enhance engagement between NHI's members and pharmacies for better health outcomes. Dr. Da Costa Abuaje highlighted the role of the e-pharmacy system as a solution to track the performance of these pharmacies. This initiative is expected to enhance the efficiency and accountability of community pharmacies within the NHIS framework. Now, the National Health Insurance Authority has met with stakeholders in Kufuor to discuss key reforms aimed at improving the efficiency and effectiveness of the National Health Insurance Scheme. The meeting was part of the National Health Insurance Authority's ongoing efforts to gather support and advocacy for the proposed changes, which are designed to enhance service delivery, expand coverage, and ensure financial sustainability. Some of the discussions held at the meeting included expansion of coverage, extending national health insurance coverage to more vulnerable and undeserved population, financial reforms, stakeholder collaboration, and digitalization of services. In other news, a team of system developers from the Pharmacy Council has collaborated with the Corporate Affairs Directorate at the National Health Insurance Authority to train staff on the modalities of the e-pharmacy initiative. This forms part of an implementation plan which is yet to be rolled out in a few months. The project is housed on the National Electronic Pharmacy Council platform and seeks to enhance access to medications offering home delivery or in-person pickup from selected pharmacies. The investment unit of the Finance Directorate of the National Health Insurance Authority has engaged staff on the status of their Provident Fund contributions. The NHIA Provident Fund Scheme's chairperson, Eva Okaim, and a team from the United Pensions Trustees Limited walked the participants through the progress made on staff contributions of the Provident Fund.
Hey, what's up?
How far with your internship?
To be honest, I'm so nervous about starting this new role on Monday.
Oh, please. I know you'll be great at it. You should be worried about what benefits they have. Example, do they have health insurance?
I doubt they will have that for interns. But no shaking. I have NHIs already.
Actually, I'm still line.
Ina, look at you. What are you going to do in the office when you can just download the app to register for an NHI's membership?
Yes, my people. You heard right. You can now download and register your membership on my NHIS app. No long queues or tedious paperwork. All you need is your Ghana card to register for yourself and for others. Once you register, you get a new digital NHIS card on your phone. My NHIS app gives you access to credentialed health facilities and services across the country. NHIS covers over 95% of disease conditions in Ghana. Access to healthcare just got easier.
Now let me sign up quickly. Miss Steph, I'm starting work next month.
This is how we wrap up on this week's edition of NHIS in a Week. My name is Ifia Trema. Kindly visit our social media platforms displayed on your screen below. You can also visit our website, nhis.gov.gh, for more stories. Thanks for watching.